It's a medical emergency where quick intervention could save a life. Each year, more than 800,000 people experience a heart attack, which happens when a blockage in a blood vessel cuts off blood supply to the heart. You may be familiar with the most common symptoms: chest pain or discomfort, shortness of breath, and feeling lightheaded or faint.
If you believe you're having a heart attack, experts say you should call 911 right away.
But we found not all heart attacks present with the typical symptoms, and sometimes they have no symptoms at all.
A 2023 study from the American Heart Association found about 1 in 5 heart attacks is silent, meaning the damage is done, but the person is not aware of it. Experts say there's one group at particular risk for this type of heart attack: women.
We explore why and get answers for you about the unique factors women face when it comes to caring for their hearts. It started as a typical summer day in 2024 for Janet Furr.
Kind of warm, kind of humid.
Her neighbors were out of town and asked her to water their flowers.
And I thought, gosh, my heart was kind of palpitating a little bit. And I thought, that's kind of weird, but I thought, well, I was just, I rushed around and came back in. It was hot, drank some water, felt okay, went to sleep, felt fine.
But the next night, she says that strange sensation happened again.
And my watch had gone off and said I had a rapid heartbeat.
She had a feeling something was wrong.
So I told my husband, I said, I really need to go somewhere.
What Furr learned at the hospital that night changed her life.
I'd had a heart attack within the past 24 hours. No symptoms whatsoever other than just the rapid heart rate.
It's hard to imagine something so serious could go unnoticed. But according to the Cleveland Clinic, silent heart attacks can be just as dangerous as a heart attack with intense symptoms, such as sharp pain and loss of consciousness.
We think we're invincible. It can't happen to us. It's always going to happen to somebody else. But I am the somebody else.
While experts acknowledge silent heart attacks are more common in women than men, according to Leslie Cho, the reason for that isn't so obvious.
It's very unclear why men and women have different sensations.
Dr. Cho is the director of the Women's Cardiovascular Center at the Cleveland Clinic and says one important factor is historically the cardiovascular system has only been studied in male bodies.
There is truly sex differences in heart disease, and we continue to lag behind in our knowledge for women's heart.
In 2020, Dr. Cho helped to write the American Heart Association and American College of Cardiology's first comprehensive study of women's cardiovascular health since 2011. Dr. Cho says women in particular face unique risk factors for heart disease, such as adverse pregnancy outcomes.
So if you had high blood pressure during pregnancy, gestational diabetes during pregnancy, if you delivered very prematurely, those are all increased risk for having heart disease later on.
According to the American College of Cardiology, adverse pregnancy outcomes, which occur in up to 20% of all pregnancies, can increase the risk of cardiovascular disease up to 4-fold. Which is why the Cleveland Clinic now refers patients with adverse pregnancy outcomes to its preventative cardiology department.
So we can actually assess you, not to start you on medicine, but to make sure that you're on a good pathway so that you don't develop high blood pressure, so that you don't develop diabetes later on.
But it's not just silent heart attacks that pose a cardiovascular threat for women. According to the Cleveland Clinic, people who have recently given birth or women experiencing postmenopause are most at risk of a condition that can bring on a life-threatening heart attack with few warning signs. It's called spontaneous coronary artery dissection, known as SCAD.
First, I got like a really funny feeling over my body. That's all I can say. Funny feeling, and it made me stop.
Just after Valentine's Day in 2024, Vicky Mascarenio Nelson experienced intense chest pain, but brushed it off as heartburn.
I did not know I was having a spontaneous coronary artery dissection.
It occurs when there's a tear in the wall of the coronary artery. Blood can get trapped in the artery walls, which could trigger a heart attack. In fact, the telltale signs of SCAD are heart attack symptoms such as chest pain, dizziness, heart palpitations, and shortness of breath. While experts aren't sure why it occurs, more than 90% of cases are in women, which suggests fluctuations in female hormones may play a role.
So it's important for women in particular to recognize if they feel something off that they shouldn't just sort of brush it off.
Dr. Sherry Kadinga is a cardiologist at the University of Vermont Medical Center. She says many women are familiar with pain and used to putting others' needs first and may be less likely to reach out for help.
I hope that we listen to our bodies more, and that when we need to slow down and take care of ourselves, we are able to advocate for ourselves in order to do it.
As for Vicki and Janet, both women say they're sharing their experiences to inspire other women to take charge of their heart health.
You appreciate every day. You could have been gone in a split second, just as easy as you're here. You wake up every day and say, I'm thankful I have today.